The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, how are you? Thanks for watching the Mind, Body, Spirit show. And today we're speaking about singing, about music, about sound, how this affects the way we feel. It can heal us. You'll love this show. I promise not to sing any songs, although if you look at this picture here, you won't believe this. That's me as a 14-year-old, playing the piano at Carnegie Hall. Would you believe that? Yes. My parents put a piano in our kitchen in New York City. It was in the kitchen, and they would make me practice every day. It was a one-room apartment. Yeah. One room, 3 people slept there in a kitchen and had a piano in there. So now you know where I'm coming from. So there's healing in sound that we appreciate. And it is the ear. The ear actually is, as a fetus, as we're developing, the ear is the first organ that develops. Would you believe that? Yeah, that's been well studied. That has been well studied. And a infant, a fetus, can actually hear noise, music that is in the room, or that the mother might be singing a song, and can affect the child in the uterus. Mm-hmm. And some of the effects can be long-lasting, so they're much more musical, for example, when they grow up and they're healthier and they're happier. Yeah, very interesting. So sound affects every cell of your body. We have about 100 billion cells and trillions, about 10 trillion neurotransmitters. The peptides that run between the axon and the dendrite that sends the messages across. So if you keep this in mind, we are but neuropeptides, neurotransmitters, hormones. Just visualize all that going on in your body at all times. I've studied that, so I can literally look at somebody, and when they're telling me their story, I can see their neurotransmitters almost, so I know how you feel. But music affects the sound of every cell. It affects your immunity. Yeah, whether you can resist the disease or cold depends on how you're feeling, whether you're positive or whether you're negative. And also, because it affects immunity, it can destroy cancer cells. It can affect your gut. There's trillions of bacteria living in your gut. And music and sound and the rhythm of it can affect your bacteria living there, and the people around you, and your child, and your dog, and your cat, and even the plants. They have found out that sound can affect plant growth. That has been studied. Isn't that interesting? So you hear the term entrainment, powerful rhythmic vibrations of one object are projected upon another with a similar frequency. So the sounds, what we're saying, a voice that's loud or soft or rhythmic can affect the neurotransmitters, hormones, neuropeptides of another object, like an organ even in your body or someone standing close to you. So it can restore harmony in your body. So you listen to music or you hear sounds and they affect the cells in your body. Actually, music and sounds go back millions of years, and what came first, speech or sound? They're not certain yet. They're not certain that. But years and years ago, they did chanting. That was music. Just to say the same word over and over again, and there were choirs like that, and religions, many of them were that. That's going back many, many years. So there are people, for example, who have infectious disease or cancer, who felt that music cured them. Mm-hmm. And the studies have been done, and there have been some positive thinkers do better. And if they're music and exercising through dance, for example, they run higher cure rates. That's been proven. So, but all of creation, going back millions of years, trends towards harmony. Plants, animals, humans, and music helps establish harmony. Okay, and many different instruments were used years back. Many are long gone, and was depending on the sounds people were listening to, different in different cultures, Oliver Sacks, who is no longer with us, but he's written a lot about. One book was called Musical Philia, love of music, and he says specific music like Schubert, music by Schubert would pierce his heart. This is what he felt, and he worked as a rehab psychiatrist in New York City, and I remember reading that he was walking down the hall his first day with a nurse that had worked there for a long time, and they were walking past two men who were frozen in place. They had a dyskinetic disease, and they were just frozen. They'd been that way for years. And the nurse that was walking with him flipped a switch, and music started. And when they walked a little further, they heard a noise. They went back to the room where the men had, it was called a locked-in syndrome, dyskinetic syndrome. Those two guys were having a fist fight. What happened? The music causes secretion of dopamine, a hormone, which unlocked them. And as soon as the music stopped, they were frozen in place again. A real physiological change in the body. I myself noticed when one of my relatives lived in a rehab center, nursing home, whatever you would call it. She was there about 6 weeks or so. I brought in music on Saturday, and they played it, and they had about 10 people in wheelchairs there. And you notice how much more happy that they were, moving more. And actually that lasted a few days, because they told me that at the rehab center, versus the dopamine secretion and the dyskinesia. As soon as the music stops, bang, they're frozen again. So, but music will last for a few days, and of course it all works through our ears. Dr. Tomatis from Paris, we're going back, 50, 70 years, was very interested in the ear and effects on humans and where we would hear. And he studied it extensively in Paris. And matter of fact, there were Tomatis centers all over the world, probably 500 or so. He was just, where do the impulses register? You know, you get the earlobe that collects the sound, and then goes to some bones, and then it goes through the cochlea, and then it connects to the right side of the brain, and then left side of the brain, and we know pretty specifically where hearing is located, but there are centers, but it in essence really is all over the brain. But it's rhythm, and dancing is more on the right, for example, and left. And they found this out because they operated on people, removed parts of the brain, say for epilepsy, and they found out that it affected their appreciation of music. So different types of music do different things to people. You have Brahms, Requiem, the Zelensky's Lamentations, harmony and healing, different type of music. So every organ of your body has a vibratory note, these doctors would say. So I say to you, find your song. We all appreciate music differently. What I like I believe it or not, I do some tap dancing, you know, and I've gotten pretty good at it. I like to do it to the Bee Gees, but this harmony is coming. I feel it in my body, and I do improvisation. I don't like to memorize certain steps, which I have, but I like to improvise. I do what my body wants to do, but in rhythm. In other words, I'll do it 4 steps, 8 steps, or whatever. So you can see that the music affects my body, and then I able to do to certain types of music. It's fascinating. So find your song, find your dance. It's relaxing. I do it to relax, and it's good exercise. So a disease is when your body is out of tune, okay? So because we have all of our body, trillions of cells, neurotransmitters, neuropeptides, 50 hormones, all interact with each other, but you can affect them through exercise, through music, through singing. And music and singing and dancing is a lot more fun than say, oh, I hurt all over. I'd rather have you say, I feel wonderful all over. Okay? So music brings molecules, very tiny, that are in disarray, and makes them whole, makes them harmonious. And we have different instruments which come out with different timbre. Timbre, that's a violin versus, say, an accordion, okay? Maybe the same note, but it sounds differently. That's called timbre, T-I-M-B-R. The rhyme, harmony is the length of a note, okay? It's the length of a note, okay? Tempo is how forceful is it? If I tap dance, for example, would I go like this, or like bang, go like that? That's the tempo of it, okay? And so when you're listening to Chopin, for example, if you visualize the song, the tempo, the notes, the harmony, it can improve a Parkinson patient's. They have this tremor and they are rigid. But when you play that type of music, that seems to calm down. I'm a neurologist, neurosurgeon years ago, and I remember turning on some music, and I see the patients, they were just very, very rigid. But when I played that type of music, they were stronger. They were not as rigid. They were not shaking as much. but it didn't last much beyond me playing it. Okay, it didn't last for 3 days like the people in the nursing home. So we do have some auditory dopamine. In other words, we hear certain sounds and they release dopamine, which is in the circuitry of feel-good hormones in our brain. Okay, they get released and make you feel good all over. And I think we're all familiar with that, for example. So what music and laughter can do, it can, laughter and music, same time, affects same hormones, decrease high blood pressure, decrease stress, decrease anxiety, decrease fear. When I was working full-time as a neurosurgeon, I was driving between hospitals. I remember turning on the radio or I have a CD of a certain sound, and yeah, you wouldn't believe this. I was literally conducting the orchestra, but that totally put me in a different mood. I was feeling great. I remember listening to an opera that I enjoyed, and I think it was Pavarotti was singing, and I was supposed to go to Bryan, Ohio. I ended up in Defiance till I woke up, realized reality. So I had to drive back to run my clinic. That's how it entrained my mind. Okay, it can decrease depression. People, we all get depressed about things here and there. I mean, who doesn't? It's a more likely occurrence than in the morning. Turn on some music. And there are a lot of illnesses that are due to certain kind of hormones in your body. They give you symptoms. I call them mind-body illnesses. When people came to see me, I would say to them, unless it was obvious what was wrong, and what's going on in your life? They said, oh, you know, my husband has left me and I don't make much money. I can't take care of the children. And I did not just look at the x-ray. I wanted to find out what was going on in your life. And a lot of these people, I would tell them about music and exercise and visualizing a more pleasant thing. It would decrease anger, decrease job stress could be the same. Maybe plug something in your ear so you don't hear the stressful things, and you're hearing music, and you know you might even be shaking and feeling a little better. And I think when I would do brain surgery, some tumors, especially if they're benign, not malignant, they would last for hours. You know, I'd be there 6 or 8 hours sometimes. I played the music of André Rieu, I-R-E-U. He's from Europe, and I just liked that music. A lot of it was German music too, and I knew him personally, and I lived in Germany as a child, and I'd play music the whole operation while I'm operating. It helped me concentrate. I remember the nurses at the end coming out to me and say, Dr. Cashman, I didn't know I had been at work. So that I always enjoyed hearing that. But it depends the type of music you're playing, okay? I got a relative who's a neurosurgeon too, but he plays different kind of music. And the girls will walk out of the operating room like this. So nothing's perfect. You always got to ask, hey, is this music okay? You know, which reminds me too, is that patients who are asleep under anesthesia, I saw a case one time where I walked in the room and the patient was upside down getting ready for back surgery, essentially naked. And the people in the operating room were making comments which I did not like about the shape of her body. And I immediately chewed them out about it. And they said, oh, she's asleep. Well, you know, instinct. When I talked to her the next day, the patient's telling me that she'd heard the conversation of the people in the room. Where's the proof? Where's the proof? Because she told me what I had said. He says, I'm not going to report those people because you took care of it, Dr. Cashman. Now, that's one case, but what do you make of it? Did she feel the vibration of the words? Because she was out, and I checked with the anesthesiologist. Of course, she had all the medicines. Isn't that interesting? Yeah, it's interesting. Maybe she felt the vibration of the conversation. I don't know. So music can relax you, increase your mood and happiness, increase immunity, increase healing, and it improves movement disorders, which we talked about already. Where did the word music come from? From the word muse. It comes from the Greek. Actually, a few thousand years ago, some of the gods were the gods of music, the daughters of Zeus, the 8 celestial sisters, the gods of songs and poetry. That's what the people believed. It's in history. Mm-hmm. So remember we talked about Tomatis, the doctor from Paris. He studied and found out that you measure sound by hertz, okay? And what a human can hear is 3,000 to 8,000 sounds that affect the cognizant power of the brain. Where you hear it, it can affect your brain, okay? And so hertz 750 to 3,000 affect the heart and the lungs. So your heart can indeed react to sounds that it hears. Very interesting. And music can enhance learning and creativity with music. If you play music while a child, for example, is very young, age 3 to 6, they really don't have any harmony. It's starting at age 6 or so, where the child is exposed to music and have a great effect on their intelligence, on their mathematical ability, on their happiness. Mm-hmm. That's been studied. Tomatis studied that. And also people who've had brain injuries, it's always good if they're not doing so well to check if they maintained their musical ability. I've done that and found that people who are severely disabled still some appreciate music. Some can even partially sing a song, and they're so much more happier, and they walk better, and they feel better. It must be the neurotransmitters and hormones and neuropeptides that are affecting their whole body. I've seen evidence of that. So stimulating children to music, I think, is a wonderful thing. To sing to the baby when it's still in the uterus, I think is a wonderful thing. Maybe to play the piano. Some would call that the Mozart effect. And books have been written about it, and I'll bring this up to you shortly. Now if you're saying nasty words and the child is still in the uterus, you could depress the child, for example, as activities, even when very young. So to play some music, to sing a song, speak to the baby, because remember what I said, the baby can hear starting the last 3 months of the pregnancy. In the ear is the first organ to develop. Mm-hmm. That's been studied. And even birds have songs. And you might say, well, why do they sing a song? And it was studied by Darwin, actually. Wrote a lot about evolution. And what he found is that only the males are the ones who can sing a song. So what do you think? Why they sing a song? And they have found there are some birds that, when looking for a mate, for example, will sit in a bush, and the male will sing out a song, and the female decides whether to head in that direction or not. That has been studied. Isn't that fascinating? So music increases intelligence, improves recovery from brain injuries, increases test scores. People who listen to some music who went and take a test, there's been double-blind studies, actually do better. So we have musical intelligence because the connections in the brain all over and activates them, okay? And so improves people's language skills. Rhythmic tools combined with movement improves memory. So if you're doing some exercise, some yoga, for example, and you're playing music, find out we do better on tests or work. The brain seems to work better. Interesting. It's all interconnected. And as we develop neurologically during childhood, we go through stages of memory. Children memorize things a lot better than adults, and memories from childhood last longer than adults. I remember my 97-year-old mother could recite poetry, and especially when I turned on some music. I mean, it was just unbelievable amount of poetry that she learned in Germany. But when I asked her what my name was, she didn't seem to come up with it. That was just the last year or two instinct. So route memory, like a poem, she was always dancing, laughing, singing. They're interrelated. And so the more music children are exposed to before they enter school, the more deeper the stage of neurodevelopment will assist them through their lives. Instinct. Turn on the music, sing a song, take up tap dancing. About 20 years ago or so, I was appreciating the music of André Rieu, R-A-U. That was the biggest musician in Europe. And I somehow got to meet him because I took my parents to a concert he gave in Fort Wayne. And we developed a connection. So I even went to his hometown years ago because he invited me. And I have a picture of him and myself. And he invited me even backstage, so I developed a musical connection. And one day, we were in Maastricht. One day, he put on a concert every day for 5 days. And one of them, it was for free for people who lived in nursing homes. And I remember picking a lady out of a wheelchair who could barely move. And when they played a waltz or something, I waltzed with her in place. And it was amazing how she loosened up. And our circle of waltzing got bigger and bigger, and the audience just loved it. It's even recorded. I think one of his CDs called Homecoming, and the extras, I think, were in there. Again, music did that. And even Norman Cousins became very interested in music because he was sick quite a bit, and he visited Pablo Casal, the world-famous celloist, who was severely disabled, could not play the cello, and was very, or the piano, and he went to his hometown to visit him, and they walked up to the piano, and this very disabled Pablo, who could barely move, barely walk, elderly, started pounding the piano and heavy, and then he started pounding, bum, bum, the whole body loosened up, and him and Norman Cousins took a walk, and then as they came back to the town, and he became stiff again. So this is what neurotransmitters, hormones, do that in music. So if you visualize the gold, I think Pablo visualized that he could do that. That helped. But music is ubiquitous. It's all over our brain. It's more concentrated maybe in the left parietal area, but it's all over the place. And So in our nerve cells, although we lose some as we get older, we also have neuroplasticity, and we build some. So if you're singing and playing the piano or tap dancing, doing something to music, it helps grow brain cells. Neuroplasticity is something important to remember. So music is a pacemaker. When it has a certain beat to it, a certain pitch to it, certain harmony to it. You know, we have scales of 3 and 4, and our brain reacts to it better. Mm-hmm. Very interesting. So, orchestrate your life. Okay, music can catapult the mind, body, and spirit faster than any medicine or procedure. Remember I told you about getting in my car after a difficult day, and you're going to live, you're going to die, you're going to be paralyzed. That's how neurosurgeon spends his life. I turn on the music, I'm going to another hospital, and within 10 seconds, I'm conducting the orchestra. That's how quickly it reacts. No medicine could do that. So I was healing my mind, body, and my spirit. So music can be a primary healing tool. Mm-hmm. So I agree. We need to teach our body to play its own music. Develop whatever for us is different dance steps, different things you like to listen to. Some is jazz, and some is singing, some is opera. I carry probably 20 different CDs in my car. I can always put them in there. But now you can, on the latest things on the radio, you can pick a channel that plays only jazz, only dance music, or whatever. You can pick them too. Margaritaville, I had on before I came in here. John Lennon, I listened to him. They have stations that specialize in that, but certainly the easiest thing is just to plug in a CD. And the one I'm playing right now is Goldie Hawn, Christmas. Oh my God, how beautiful. How beautiful. And then the jazz and samba has a lot of improvisation in it, a lot of repeated notes, for example, but you can improvise to it. So I have certain songs. Barbra Streisand and Guilty as a song. I can improvise my tap dancing to that at a specific harmony and rhythm. So hum a happy tune, okay? And oh, what a beautiful morning. Oh, what a beautiful day. I have a beautiful feeling. Everything's going my way. I sing that when I'm taking a walk in the morning. I take a walk in nature generally, even on a snowy day like today. And by different seasons, you can do that. Maybe pick different songs for different seasons. And I sing to nature, and sometimes the birds even sing back. Yeah, I have a red cardinal that follows me around, and he's tweeting and singing, and I'm singing and tweeting, and it makes you feel good. Yeah, it makes you feel good. They play music in dental offices, you notice, and sure need it there. So music can activate the right brain and then the more logical left brain. So the body is a complex orchestra. Thousands of instruments that conduct themselves, your organs. They react differently to different sounds, harmonies, and rhythms. So we have an ever-changing score and repertoire, okay? So it will vary. So our organs are the instruments. The brain is a conductor, okay? And billions of brain cells and trillions of neurotransmitters, 50 hormones, neuropeptides, so all interacting. So just try to visualize this interaction of neurotransmitters, hormones, neuropeptides, different pitches, different meters, different notes, different harmony. Can you imagine what's going on actually in your body? Visualize your body like that. Because I was reading so much about it and teaching so much about it, I could see patients actually, I could visualize their neurotransmitters. It got pretty bad, but it told me a lot. So you are not just your X-ray. You are a summary of the hormones, the neuropeptides, the sounds, and the rhythms. That's who you are. So so what is music? Organized sound. We actually can hear 20 to 20,000 hertz. Thoughts and feelings are dependent upon the laws of vibrations. Everything vibrates. Quantum energy. The whole world is vibrating. The stars and the moon, everything is vibrating. Chanting, laughter, humming, global sacred music, which, even thousands of years ago, there were a lot of chanting in churches, for example, the same sound, but it was cause and effect. And then we developed different instruments which vibrate at different frequencies. And so music is really our original language. People are uncertain, what was first, music or speech? I say music. I say music. Even animals appreciate music, to a certain extent, no doubt about it. I already told you about Oliver Sacks, who wrote many books, Musicophilia, and he worked at the Beth Abraham Hospital in New York City. I used to live in New York as a kid, where I learned to really appreciate the music. Remember the picture of Carnegie Hall, and then now they're using music for therapy. That was really born in 1944 in Michigan State University. They were big about it. So they would even say every disease is a musical problem. Every cure is a musical solution. Interesting. I would certainly agree it is partially so. And there are people who are positive thinkers who cure themselves totally by the way they're thinking and music they're listening to, and whether positive or negative. You could fully understand that when you think of what's going in our body. The fetus, the baby, can hear generally around 3 months. Tomatis studied that. Other people study that. Mozart, as a baby, heard violin concert music played by his father and his mother. Tomatis called it The Conscious Ear. There's a book by Tomatis. I have it at home. This sick. I didn't bring it today because my other books made my bag so heavy. It's this thick. I've read it. I have it at home. You want to borrow it, let me know. But you better give it back. That's really a great book. The story in there about someone visiting Tomatis Center in Paris, and they thought they'd get into a small office. No, it was a huge, huge room they went to, and there were different people with different instruments. Some people trying to stop seizures, some there with cancers, some there with hearing problems, and all he definitely was the world's expert and probably always will be. And he said Mozart music is a good mother. It can give you a hug. So the ear is the first organ to develop in the fetus. Why did they think so positively about Mozart's music? That's been studied many times. The high pitch, the frequency, children do seem to learn better, seem to be smarter, are more musical after listening to Mozart music as an infant in the uterus in the first years of their life. So Alfred Tomatis is the Einstein of sound, okay? To his patients, he is Mozart. Tomatis centers are all over the world, yeah. He's no longer living, but so we talk about the Mozart effect. A Don Campbell is a book I'm going to hold up. I encourage you to read this. Written many books, okay? As a matter of fact, I ordered another one today. This one's, and the next one I ordered was Mozart Effect on Children. I mean, it'll be more detailed. I already know a lot about it, more detailed. So to give children keyboard training, for example, like my parents give me, pitch training, motor skill training, it improves all that. Sight reading, playing from memory. After 6 months of doing this to a child, you do it every day, okay? Pitch training, motor skill training, sight reading, playing from memory. After 6 months, all could play Mozart. Wow. What a great thing to do for a child. And I thank my mother for doing that. But I'm still upset she didn't give me singing lessons, but I'm taking them now. But I think I'd have been better. Because the thing for kids to remember is, and tell your kids that too, is once we're over this virus, you belong to a fraternity or a club or a social gathering or a family gathering, the person that can play the piano and sing a song will have a lot of good-looking guys or pretty girls sitting next to them. That's what happened to me at IU, because I could play the piano. Guess who was sitting next to me when a sorority came over? They all sit next to me. Okay, now I was not the best-looking guy by a long shot, okay? But if you could sing a song or play the piano, that's where the good-looking guys and girls are. Listen to me, kids, okay? So, and it can increase their memory. It improves their memory. So Mozart's parents said our little boy was born to violin music. Interesting. And they actually think that we are not born with musical brains, that anyone, we're not all alike, but almost anyone can be trained in music starting at age 6 or so and improve their intelligence, mathematics, enjoyment of life, the smiles on their faces. And so it can lift our souls, compassion, love, dance, singing. Actually, they played music to plants and found they grow better. They had control studies. They proved it. Well, that makes sense. We're all related. Us, the animals, the plants, we're all interrelated. Some are just have more genes than others and can be affected. Okay. And remember, I already told you, stress improved. The people felt in the operating room. It affected the employees. It affected, I think, the patient, as I already mentioned. So music is a primordial breath of creation. It goes back in antiquity, yeah. Vocal nourishment is as important as milk. Although this PowerPoint was done a long time ago, I've read Joe Keon's book, Whitewash, Don't Drink Milk. Once you read that, you won't read it. Maybe almond milk, but cow's milk has been contaminated. It's not very healthy. I'll leave it at that. Music increases creativity, intelligence, and linear reasoning. And also while you're getting a massage. So simultaneous music and massage are very relaxing. I mean, that's very relaxing. It builds a bridge between the deep, revitalizing the experience of a massage and the world to which we must return. And I think it's, like I said, it works too. And whenever I have my teeth worked on, and I'm a little claustrophobic because I was locked in a closet when I was a child. I went to boarding school, and I've never gotten over that. So to play some music helps me in situations like that. And if you use imagery at the same time that you image something better or something you want to accomplish, it's much more likely to happen. And it improves the placebo effect. If you believe this so-and-so thing will do this for you, if you're playing music at the same time, it really helps. And it also decreases the placebo effect, the nocebo effect, that if you pick something up and you think, well, this is going to harm me, it probably will, but if you're playing music at the same time, it reduces that effect. That's a word not many people know a lot about, but I wrote a book on it. Nocebo, placebo's evil twin. Positive and negative thinking affect how we feel about something that happened to us, okay? So imagery, image something. Famous great athletes image the shot. Yeah, the greatest golfers, for example, will visualize, have an image before they hit the ball of where the ball will land. Mm-hmm. It's true. Yeah, the famous athletes do. When I hit a tennis ball, and I played tennis for 50 years, I image where the ball is going to land. And that increases the number of first serves. Yeah, I do it all the time. Tennis players do that all the time too. So imagery, music has enormous powers to shape human life. Okay? And in the primordial sound, Ayurveda, you hear about Ayurveda, that's a primordial sound that connects with your brain. So again, it affects our trillions of brain cells, billions of brain cells, trillions of neurotransmitters, our 50 hormones are all affected by our imagination, our imagery. The Chinese use musical therapy much longer than we have. Indians, people from India, use healing music, as well as our native Indians use music. Yeah, they use drums a lot for healing, and so Argentinians, from people from Argentina, they had ancient musical vocal techniques, the voice. Mm-hmm. And in Africa, people from Africa use different types of music with drumming and dancing. It was very effective. They used it for healing, relaxation. Rock music is a two-sided coin that keeps on flipping. Good to tap dance too, incidentally. Makes it so. Visualization and sound work well together, and so it is thought today that dance and songs preceded human speech. That's what the research seems to indicate. So that was humanity's original language, was music. Mm-hmm. The bone flute is the oldest instrument, as far as you know, 50,000 years ago, and they have found some. And ancient healing systems use shaman, spirit, sounds, and they would have healing ceremonies. They would put the sick person in the circle, and they go around and they would dance and they would sing, and they would imagine them becoming healed, and some did, and some did, and some didn't. Matter of fact, the shaman sometimes, if they didn't want you in the tribe, would point his finger at you, and if you believed, if they played certain music, and if they pointed the finger at you, you felt you would die because of all the hormones and neurotransmitters. They would die. That's actually in history, and so the power of music to integrate and cure is quite fundamental. It's quite fundamental. And remember, I told you already, it works in Parkinson's disease as long as you get the music on. And actually, people who have dementia, for example, can be helped with music therapy. People with brain injuries, and it can help the brain to heal, neuroplasticity. And people who have pain, it's helpful. It's a diversion for one thing. It gets your attention away from the pain that they're having. And it should be used for a lot of chronic pain problems, especially people who are, say, addicted to medication. I might be able to give them temporary, some people, permanent relief. Sometimes learning dancing techniques, exercise techniques can get a person over an addiction. And who's the greatest drummer in your body? Your heart. That's the greatest drummer, okay? And so when people are drumming, for example, 10 minutes of drumming releases tension. It's a good relaxer. And the thing to remember is you can't make a mistake. Just like improvisation, like I do when I'm tap dancing. I don't want to have to think of the steps. Whatever comes to my mind, I've practiced it, I've rehearsed it. I go by the rhythm and the tone and the temp to see whether I want to hit it lightly or strongly. I can't make a mistake, so I feel great when I'm done. The Bee Gees is my favorite. Barbra Streisand, Guilty, it works pretty good too. I did notice recently, though, that I seem to be able to tap dance to most Christmas music. That's kind of interesting. And and Trayman, which I mentioned before, explains how brain waves, heart rhythms, respiration, emotional tones, timing, pacing, and other organic rhythms change to music. To music. You respond, the body responds. George Gershwin music, very famous. Music sets, he says, music sets up certain vibrations which are also a physical reaction. So it's emotions and the physical body. Eventually, the proper vibrations for every person will be found. Interesting. So don't give up. You feel depressed, keep at it. Find your song. Find your song. And I every day, be honest with you, every day play the piano a little bit. I'm not as great as this picture shows, believe me. And because of the virus, I was taking lessons regularly, just to improve, talk to somebody. I found taking piano books, I started page 1, and I've been through about 5 books in the last 6 months. I every day do about 5 pages, one after the other. And you know what I found out? It was a lot better than taking lessons. So if you had beyond a fundamental stage, incidentally, you could learn on the internet, but still, personal lessons are motivating. I've had tremendous improvement in my ability to play the piano. And interesting. You might try it, especially with that we have to stay home now. So I want you to find your vibration. And we mentioned already that musical therapy is used, okay? We can use music and self-generated tones to help us become more sensitive to our own rhythm and cycles. A Dr. John Kellogg, who lived in Michigan, the cornflakes guy, ran a institute called Neurasthenia Institute, where they, at that time, hospitalized a lot of people with mild psychiatric problems. I mean, some were very depressed, but a lot of them I had neck pain, low back pain. It was the stress of life and mild depression. And he used music up there a lot and found out it helped. He touted music and visualization for healing. Things that, I believe in. I wish he hadn't sold all those Kellogg products, though, which in the end caused a lot of diabetes and illnesses and increased rates of cancer. Everything he did wasn't good. Sorry to bring that up, but that's the diseases I'm seeing mainly now. But he touted music, visualization, entrainment, organized patterns. Yeah, these were hospitals up there, and that was the way they treated sort of semi-psychiatric problems. And so now we talked about tap, but what about a wrap, okay? Wrap and unwrapped. Wrap really bad. That's the way I feel. Can't they see I got a bad, bad deal? If they would only listen to what I want to say, I would not feel so bad each and every day. Tomorrow morning, I'm going to write another verse, and I'm going to tap dance to that. They may call it rap, but I may call it tap, rap, and unwrapped. And so, as I already mentioned, that drumming, chanting, toning, so it connects the mind, body, spirit, and the breath will attain and will heal. So, in the drum of life, ancient cultures used it a lot. Dancing, tap, Zumba, the Tao of rap, singing. This may have preceded, actually, speech. I highly encourage you to bring it into your life, okay? And I don't know if it's Baroque music, classical, jazz, country, salsa, big band, rock, heavy metal, religious. That's up to you. Whatever makes you feel good. And I highly encourage you to do that. In spite of my complex life, it really makes my day, because I do this in the morning. When I make me a cup of coffee, I go through about a 1-minute tap routine. About 15 different steps. I do it every day besides the other regular thing. And I sit down and read a book. So music slows down brain waves. It masks unpleasant sounds. It decreases respiration, heartbeats, decreases muscle tension, increases endorphin levels, the feel-good hormones, increases immune functions, decreases stress hormones, increases memory and learning, increases productivity, increases romance and sexuality, improves digestion, and increases a sense of well-being. Is that enough for you? So, rap on, tap on, turn on the music. Next time you see me, sing me a song. I may sing one back. If you need to see somebody about stress, depression in your life, diabetes, see me at the Three Rivers Pharmacy, where I go every Friday, and I'm going to be there tomorrow. And maybe I'll sing you a song. I care about you. Love you. Bye-bye.